No, it's fine. It's fine. We spoke. Hello. I am Isaiah Febus, not Nicole. And so we are here to talk about OhioRISE today. As we talk about OhioRISE, who here has heard of OhioRISE? Sweet. So we don't have to go in depth through some of these different parts. As you know, OhioRISE is a very new program to Ohio. We started in 2022, so we will be celebrating our 2-year and starting our 3rd year of OhioRISE in July 1st. So we're super excited about that. But as we talk about OhioRISE and our long-term commitment, really we are aiming to keep children and youth close to the home, close to their families. We want to prevent and reduce relinquished custody of kids. We want to keep families together. We want to reduce hospitalizations, decreasing involvement with juvenile justice by offering services. We want to reduce out-of-home treatment and out-of-the-state placement, so we've added programs for that. And of course, we want to increase school attendance and performance. Oh, I moved this, so let's see how this works. There we go, sweet. So some of our programs that came to OhioRISE that are now covered, we have care coordination. So we talk about different tiers. Really, it's care coordination, regardless of where you're at, whether you're intensive, moderate, or limited, you're receiving care coordination from an individual care coordinator. We also offer IHBT, intensive home-based therapy. In-state psychiatric residential treatment facilities are now available. We call those PRTFs. We also talk about behavioral health respite. Primary flex funds are also available in an amount of $1,500 in a 365-day period. And so with primary flex funds, they reduce the need of other Medicaid services, keep young people and their families safe in their homes, help child or youth better integrate in the community. Our care coordinators are very creative when we talk about primary flex funds. We have to tie it to a care plan goal, but they really work with the team on identifying the benefits of that using those flex funds. And then of course, MRSS. So most of these services, you have to be enrolled in OhioRISE in order to receive these enhanced services. And so we always get questions, does it matter what tier a child is on when we talk about tiers, limited, intensive, or moderate? No, as long as they're enrolled in OhioRISE, they do meet the qualification for these services. So what are the criteria for OhioRISE? Of course, you have to be Medicaid eligible between the ages of 0 to 20, and then require a significant intensive behavioral health treatment. That comes with a CANS assessment that is completed. And once that is completed, it shoots out a recommendation of tier level. And then of course, if they have private insurance, we can also work with the families on completing the 1915C waiver. So something that comes from is for myself and Nicole, we are the CME, so we represent Hamilton County. So someone at our agency, one of our agencies, would have to complete that 1915C waiver. But there are plenty of CANS assessors in the community, in the county, that can complete a CANS assessment for Medicaid eligible clients and youth in the community. So we do see that come across, and we are able to work with you on identifying where that care coordinator is at and where they're at in terms of services and everything else, and getting you connected with the team. So as I said, the care coordination, really we want to meet families where they're at. And so while the CANS will shoot out a score, whether it's intensive or moderate or limited care coordination, we really want to meet with the families and ask, what is the need? Are you needing services? So as we're reviewing that CANS and we're talking with the families, we're identifying what their needs are. And so when we talk about, intensive services and what that looks like, we're talking about someone that, hey, we're going to be meeting a lot more. We're going to be meeting about 4 times a month. We're going to be doing phone calls. We're going to be doing visits and checking in on you to see how things are going, because there's a lot going on, and we know this can be overwhelming, especially when our youth are involved in the hospitals. Families are very confused. There's a lot of jargon being thrown out there. So our care coordinators are really there to kind of help the families understand what's going on. And so as things start to improve, we talk about moderate care coordination, things kind of reducing a little bit. We're working on the plan, we're working with the team. We may see some of the team go away because we don't need as intense services. That's okay, it's part of the process. We use the high fidelity wraparound model, and we really are about team and adding team and natural and community supports on that team. So some of the things our care coordinators do, we do offer, like I said, face-to-face visits. We have child and family team meetings. We have a child and family care center plan. We do crisis and safety plans. Those are things that we are doing within the first 30 days of meeting with our families. We are working on referrals and linking them to services in their communities. We don't want them driving way out to Dayton when we have services here in Hamilton County. Something that our families often don't know about is what services are available within their own community. Our care coordinators meet families where they're at, whether it's telehealth or we're going to the library to meet. Sometimes families don't want us in the home because they may feel embarrassed, or they might not have a space to hold 20 people in their living room. So we really do try to find unique ways to meet our families where they're at. We really talk about that family voice and choice. And so sometimes it may go against what maybe a hospital or a therapist is saying. And so we try to reiterate what the family's trying to say in their own words and helping families and youth understand what's going on. Often when you try to make plans about the youth or about families without including them, they typically fall apart. So we really do make sure that we have them in the center of the conversation. And so OhioRISE is an entire state, but as you see from this map, Hamilton County is covered by both Lighthouse and Healthline. But also if you see along here, the pink, this is also all of Healthline as well. So they serve a large portion of, it's South Ohio. And so with us, we do communicate with each other regularly about services and providers here in Hamilton County. We often try to meet you together, so that way you're not reaching out to Lighthouse or Healthline like, oh, hey, who do I contact for this? We want to talk to you together so that you understand what's going on and we can answer any of your questions. We do work collaboratively together for our youth here in Hamilton County. We don't want you to have to hear this message multiple times when we can just do it together. And next up is Nicole. You're fine. Oh no, you're fine. So the down button.
Okay. Mm-hmm. Thank you. Sorry, I'm a pain. No. Oh my gosh. I'm really Nicole. Hi. Isaiah, thanks for taking that first part of the presentation. My name's Nicole Geier-Lindsey. I'm the clinical director for the OhioRISE program at Healthline. We could not deliver care coordination in our catchment area. As Isaiah mentioned, we have the southeastern border of the state. So we've partnered with community agencies to help us provide this care. We have sub-delegated partnerships with Child Focus, Talbot House, and Presley Ridge. That all in total, we have around 55 care coordinators and 11 supervisors. Currently, this is as of the end of May, around 800 families that we are serving, or 800 youth, I'm sorry. We have a 95% engagement rate right now. Wow, that was fast. That was maybe not worth switching mics. Back to Isaiah. You could have done my slides.
Me too. Yeah.
I know.
No problem. You can say it right here because we're on questions.
Yep.
Okay, so as I clip this back on. Okay, let's try this again. All right, sorry about that. All right, so we are Lighthouse, as I said. We represent the other side of Hamilton County. So with this, we do have partners that we work with. So although Lighthouse is a CME care management entity that represents the western side of Hamilton County, we do have partners that work with us as subdelegates within OhioRISE. So we have Talbot House, Presley Ridge, Best Point, and New Path. So when we talk about care coordination, you will hear from them, and you may say, "Hey, I thought Lighthouse was the care coordinators." No, we have other partners as well that work with us. Hamilton County is a large community, and we see youth at all of these agencies. So we thought it would be best to incorporate them in care coordination here in Hamilton County, as families are familiar with these systems. One of the things when I mentioned Youth Voice and Choice, we ask families, where do you want to go? Who do you want to work with? If you live on the east side, or I apologize, the west side of town, Talbot House, you might be familiar with Talbot House. So we want you to work with Talbot House. If you have a child at Best Point, it only makes sense that you have a Best Point care coordinator that works with you. That really helps families be able to keep all their services in-house and not have to bounce around from agency to agency. And so when we talk about the Hamilton County map and what does that look like east, west, this is what the Hamilton County map looks like. And so this is a representation of all the kids that we serve within our catchment area. So with the Lighthouse, that blue area, we serve over 600 clients in just that blue area, which may seem large, but we know there's a lot of families out there that can still utilize our services. And so that is our contact information to make referrals. Same with HealthFind, it will be listed in the PowerPoint. And so you can always reach out to us via email, phone call. If you have questions about, hey, I need a CANS to get completed for a youth. I have questions about whether or not a youth is enrolled. What is the status of my referral? Sometimes when you put it into the CANS system, you do the CANS, you're waiting. I will tell you, sometimes the information that we have in the system is not always accurate. During COVID, of course, we didn't have to update our information in the Medicaid system, so that didn't happen. So we have old information, and we may be trying to reach out to someone that does not have the updated phone number or address. And so we really do try to figure out a way to get a hold of them. So you can always contact us. Typically, if you complete a CANS within 48 hours, you should hear back, families should hear back from someone about the status of the referral. They should receive a letter from Aetna within a week, and they have not received that information. Typically, it means something's not going on correctly and the systems aren't speaking with one another. So we can definitely help redirect that and get you quickly connected with your care coordinator. So any questions for us? Wow, yes. Over here.
Two questions. The first one is,
You want to sit up here?
still doing automatic enrollments at this point, just based off of medical history and hospitalizations?
Only for hospitalizations, not for anything else. So if they are hospitalized, yes, they are automatically enrolled as a tier 2 they are automatically enrolled, and we work with them. They're assigned directly to the CMEs. And then we work with them in getting connected with a care coordinator.
Thank you. And then my second question is as it relates to the waivers, and then specifically with DDS waivers, what is that communication with families in terms of families who qualify for OhioRISE but potentially already have a DDS waiver and then are also eligible for the OhioRISE waiver in terms of level of support? What is that communication with the families?
Yep. Okay.
So the family is only eligible for one type of waiver. So ideally, in a perfect world, we would hope that someone from DD is on our child and family team if they're already established and looking at the waiver. We do have some folks that are ineligible for OhioRISE, but we're able to switch them over to the waiver. So in that case, we would hope that we're all connected. But we try to run through with the family everyone and anyone they may be connected with. It sometimes still happens that families don't always identify partners, but we do part of that waiver discussion is the discussion around what are you already accessing, how are you going to maintain your eligibility for the OhioRISE waiver, and hopefully in that discussion, families would notify us if they're already enrolled in a different waiver. but they cannot access multiple waivers. And for eligibility for the waiver, I think it was mentioned earlier, Isaiah shared about Medicaid. For the waiver, we use the child's income. So that's often 0, and then they're eligible for Medicaid that way.
Thank you.
Yes.
Yeah, when you're talking about the OhioRISE waiver, is that the same as the 1915?
Yes. Yes.
Yeah, sorry, that's confusing.
Yes.
Sorry, yes.
Yes, the 1915C is the OhioRISE waiver.
Okay, and then those with private insurance still apply for that waiver?
Yes. So there are criteria in order to qualify for that waiver. So you have to have an SED diagnosis. You have to have a need for one of the waiver services as well. And so we will then work with you on identifying those documents that are needed and getting all the information completed in order to get that CANS completed and submit it into the system. And then of course completing the Medicaid application as well. Yes?
Can you share a story or a scenario of when a child and family get involved with OhioRISE versus like the other services? I guess I'm getting a little confused of like when OhioRISE would step in for the families and children.
So I would say for us, good example. So we have a youth that was hospitalized, and so they were automatically enrolled into OhioRISE. Now, OhioRISE is an option. You do not have to say, yes, I want these services. There is an option to say, no, I do not want OhioRISE. So we reached out to mom and we kind of explained, hey, we saw that your child was recently hospitalized. We are OhioRISE. We're here to kind of help assist you in managing all these services that they're throwing at you all at once. Mom said, I don't know. I'm kind of confused. I've been receiving lots of phone calls. I had a therapist call me. I have a discharge meeting. I was told to contact this other person. I was told you were going to call me as well. It's overwhelming. I have all these different providers reaching out to me, and I don't know where to go. Hey, this is when OhioRISE can come in and help navigate all that. We can have a care coordinator come, have a conversation with all your providers. Let's get everyone to the table. Let us help navigate that situation for you and get the people that need to be at the table, and really give you a voice in what's happening. We don't want providers telling you, you need to do A, B, C, D, F, G. Mom, you have a voice. And so we were able to talk about that. Mom, what do you need? And mom said, you know what, my child is doing okay. This was an isolated incident, but we really do need help in the schools. Well, let's focus on the school. And mom said, thank you so much. What resources do you have available within the community that I can connect to? And so we were able to find those resources in the community to help her. And not only that, but we also were able to identify additional supports for her kids within the community. And so we're able to do that type of work, working with all the different providers here in Hamilton County, and we can all be at the table at the same time because we're just providing care coordination for our families. So that allows us to be able to invite the therapist, invite the psychiatrist, invite youth mentors, lots of different providers here in Hamilton County in order to work with the family, the probation officer, working with the courts. So we really we touch everything really, foster care, JFS. So we really do work with the community and try to help not only the families, but also the youth get connected with those providers in the community. Did you want to add anything?
That was great.
Okay.
And just a little follow-up. So does something like a crisis situation, is that the catalyst to get you?
No.
Okay.
Now, if you're Medicaid eligible and you are needing help, you can always reach out and get a CANS complete. Call us. We'll get to come out and do a CANS assessment. If you have a behavioral, you know, wow, I'm noticing some things going on. You know, they're feeling off. I need help. Reach out to us. Even if it's limited care coordination, we can still provide service and get you connected with all those resources that we talked about. As long as they're enrolled in OhioRISE, we can get them connected with those resources.
Great, thank you.
No problem. Yes.
So regarding the flex funding, so that seems to still be the biggest piece that we can like encourage people to enroll in OhioRISE, explain like here's this opportunity for funding, but the flex funds, based off of which agency you speak with, like it seems to vary, like what could be approved, what couldn't be approved. the time to like access the flex funds feels like it takes a while for sometimes simple things like YMCA memberships or. So I guess I was curious, do you have like a form that kind of explains like here's what's covered, here's the process, and is there like any updates regarding kind of how to access that funding, at a quicker pace or? Because I do think we actively encourage to get involved in OhioRISE, but there's kind of this like, well, we don't understand like how to use the funds.
Well, you're definitely hitting on what we all identified early on with OhioRISE as a really great selling point to families, that if we could access some dollars for things that they really needed, that we could start to begin to build some engagement and trust with the family. It is a roller coaster ride. HealthFind, we are our own vendor, and Lighthouse, you are working towards that. So what that means is we at HealthFind have decided to not use the Aetna vendor. So we became our own, which is also what Isaiah's team is working on. And we've been able to shave down the time from purchase, or I guess request, to the family receiving the item to an average of 10 days. So it was significantly longer, and there are outliers. So I'm not saying every single purchase gets to the person, within 10 days, but we have some issues like returns or something gets lost, examples like that have skewed that average, but typically 10 days. We have a variety of things that we're able to help support the family with flex funds. As you mentioned, YMCA passes, coping items, oh my gosh, I think cheerleading coaches and tutoring and just all kinds of amazing things. We even bought an entire welding kit for someone who was exploring education outside, after high school to become a welder. And they could not afford all of the items that they needed for school. So we do have to be able to provide a rationale. Like Isaiah talked about earlier, it cannot be something that's covered by Medicaid already. It has to increase the child safety. And I'm going to miss the third item. There's a third requirement that's we're both blanking. There's a third requirement, but once that criteria is met, then our care coordinators have to provide a rationale that's approved. So that sometimes can be a challenge. The other piece I want to mention is that, and I'm not sure if Isaiah's team has had this happen yet, but we just had a visit from Aetna's Flex Fund administrator, and there's some changes, of course, coming. So we're trying to absorb those changes and make sure we're in line with all the rules, but a 2-year-old program, that's bound to happen, that things aren't going to be exactly written as the day they, on day one. So we're trying to sort through some of those changes, but one great thing that Aetna has identified is that items that were purchased a lot of times across the entire state, they're just going to make them available. So we don't have to go through flex funds to get something like a weighted blanket, for instance. They will just make that available, and we will be able to request that through their, I forget the term that they call those extra things.
It's like a value-based.
Value-based service, yes. Thank you, Isaiah. That was pretty good. You thought of that. So that piece, they're enhancing that pot of flex fund items that we just were constantly requesting.
And I'm sorry, one more question. Is there something that like we can share with the families that would help with the they say that we want a YMCA membership. Mm-hmm. Would it be helpful if we said, could you fill out the application, get an invoice, and then could pass it along to the care coordinator? Or
I'll tell you a couple things just last week. The YMCA pass, Kings Island passes, like things like that, they can be complicated, and we're working with a lot of different YMCAs. There's not just one, YMCA that we've been able to say, this is the way we'll do these applications forever. I just had last week a sibling set, and we thought we were to split the cost of the YMCA pass amongst the 3 siblings, and that's how we would make sure we were fair with everyone's flex fund dollars. And that's like been held for a minute, like maybe we weren't supposed to do that. So the YMCA pass, I was just sharing that as an example that it's seems to be, you know, not a standard way. The applications though, we have been able to have them on hand, like printed, or our care coordinators have brought laptops out to the home, you know, to get the family to fill out if there's an electronic application, to fill it out that way, to try to shave off the time. But the multi-family like passes, or I guess that's the best way to say that, those sometimes can throw us for a little loophole there. So I will encourage our staff to identify, you know, early on if you're seeing delays. It sounds like you might have seen a delay with that. And okay.
But it's just kind of confusing and
Yeah.
like how to access it. Like
Yeah.
we were told like we'll go to Cal Crossley, they accept the voucher. Like so it was just trying to make it clear.
Yeah, we are working on that. It has not been like the same thing every time we try to do one of those. But your list, we do have some great slides that we could easily send out that list like some of examples of things that we've been able to access, some very creative and some pretty standard things. I did realize why my slides were so short. There were a bunch missing. I don't know what happened, but like Isaiah said, we do have a QR code and a main number and email and all those things. I don't know what happened, but they'll be sent out, I hope, for everyone to access that. But my information's on there, my email. We can make sure we get you a list of popular Flex Fund items to share with families. It's a great resource, and they do lose it if they don't use it for the rolling calendar year. So we need to make sure we're getting those dollars spent for our families.
Thank you.
Yeah, thank you.